Okay, I think we're recording now. So we're going to pick up where we left off. We left off last time with postmenopausal ovarian cancer, cis-adenocarcinoma being the most common. And we talked about how these irregular outlines of the ovary with papillary projections, also known as mural nodules, especially if they have increased vascularity, are signs. The larger the ovary with the more septations, the more chance it is cancer. So on to pelvic pathology. We had started to talk about these congenital uterine malformations, which were the, let's see, the, you remember, congenital uterine malformations. The, sorry, this, how it's the, septate versus bicornuate versus didelphys, which didelphys can actually be duplicated, not just duplicated uterus, but it can also be duplicated vaginal canal. I had a patient like that once a long time ago. Usually one side kind of atrophies, so, but it's there. And I think we said septate is got the largest chance for not being able to carry. So the woman can conceive, but has a hard time carrying. And the one that is the hardest time conceiving, let's see, we'll pause this for a second. Okay, sorry, can't seem to find it, but watch it be here at the slides after all this. So the congenital uterine malformations are the bicornuate uterus, which I believe is the most common. You've got the septate uterus, arcuate uterus, uterine deldiphus, and so on. Then you've got uterine masses, both benign and malignant. Under the benign category, we have fibroids, also known as leiomyomas, and also myomas, adenomyosis, which is a form of endometriosis that is just confined to the muscular wall within the uterus. Both cysts are within the cervix. Almost everybody has them. And then you've got cervical cancers. Endometriosis is ectopic endometrial tissue. It is subject to hormonal changes, just like the normally placed endometrial tissue. People who have endometriosis oftentimes have severe pain with their periods and infertility. It can actually grow into the bowel and cause all kinds of problems. Then you have AV malformations, which is a tangle of blood vessels that include arterioles and venules. Endometrial hyperplasia is an overgrowth of those endometrial cells that are benign and not due to cancer. Hyperplasia, there's a distinction between hyperplasia and hypertrophy. Hyperplasia means there are more cells. Those cells multiply, versus hypertrophy, which means the cells grow. It's through the same number of cells that they just get bigger. So for whatever reason, people can end up with this endometrial hyperplasia, which would give you a thickened endometrium. Endometrial polyps, which are little outpouchings of tissue, usually fed by some sort of a vessel. And I was trying to figure out the term last week on what the test was for that. And it was right in front of my face. For whatever reason, I didn't recognize it, but it's sono it's, oh my gosh, I'm gonna forget the word again. Sonohysterography. Sonohysterography is where they inject saline into your uterus to get a nice fluid outline of these polyps, and then they can be removed. Endometritis is an infection, an inflamed and infected endometrium. And synechia, which is, I believe synechia is just scar tissue. Let's see. It'll give me an answer. So I don't know if you guys use or even have access to the electronic book, but it's so helpful. And you can just click on definitions and things, and it's really helpful. You can search terms, and there's a code in your book now that you're all done with it, right? That should have given you access to it. Yeah, synechia is these like fibrous bands that I believe are just scar tissue. Alrighty, so then we've got benign ovarian masses, which include cystic teratomas, also known as, what are they also known as, guys? Dermoids, yes. Okay, yeah, dermoid cysts, also known as teratomas, cystadenomas, stromal tumors, and PCOS, polycystic ovarian syndrome. You can have pelvic inflammatory disease, which is benign, not cancerous, but still can lead to problems with fertility. It starts from an infection that then goes more and more superiorly into the organs. Para-ovarian cysts that sit beside the ovary. Peritoneal inclusion cysts and Gardner duct cysts, which sit inside in the vagina, on the vaginal wall. So the congenital uterine malformations, you can have vaginal atresia or imperforate hymen. Vaginal atresia is when it's like a narrowing of the vaginal canal. Hematocolpos, which just use your terms here, blood-filled vagina, blood-filled uterus for hematometria. You could also see hydrocolpos, which would be fluid-filled, not blood-filled. Same, choose your root words there. Hematocolpometria, blood-filled vagina and uterus with the onset of menses. And in utero, fluid-filled vagina or uterus hydrocolpometria. So unicornate uterus is caused by an incomplete division of one side of the uterus. So corn U meaning corn. So if you looked at an image of that, it would look like, instead of looking like a normal uterus where you have those two horns, you would have just one. Okay, Didelphys uterus, which is a complete duplication. You could have double vagina, cervix, uteri, but they function separately and they are at 45-degree angles to one another. Bicornuate is, you can see this best in transverse, but it is from an improper fusion with two partially or complete uterine cavities, and it looks heart-shaped in transverse. When you're scanning in long and you're like, let's say, going right to left in the uterus, you'll see one fundus, and then if you keep going, you'll see another fundus. Arcuate uterus is similar to bicornuate, but with the bicornuate, you have like a dip, something like that looks like this, where an arcuate is a little bit less curved. It doesn't dip down as much. It is normal shape with an indent on the superior border of the endometrial cavity. So instead of the fundus bowing upwards, it kind of goes downwards like a little dip. Septate uterus has two partial or complete endometrium form in the normal shape uterus. So basically this looks like a regular uterus, but it'll have like a septum, like a dividing septum that goes down the center. I don't know if you guys will ever see this or whether there are any more patients out there with this, daughters of DES with this T-shaped uterus. It was, this